Vaccines during flu season, well, that gets the spotlight for sure, but it's not the only vaccine that we should be thinking about. From shingles and pneumonia, RSV, and then those back to school immunizations, staying up to date can help protect all of us against serious illnesses. So today we're talking with Dr. Cynthia Snider, Cone Health Infection Prevention Medical Director, about vaccines often overlooked and the importance of staying up to date. So let's talk about this. Throughout every stage of life, when people hear the word vaccines, I think most people think it's the flu shot, but it's much more than that.
That's correct. I think we put such an importance on the flu vaccine, but there is so much more that patients come in to seeing their primary care doctor. A lot of folks get updated on the pneumonia vaccines. Also, if you're 50 and older, it's time to get your shingles vaccine. And then, as you had mentioned, as kids, either starting elementary school or middle school or even high school, that's also some other mandated vaccines coming into play.
All right, well, let's kind of go down the list. You already said shingles over the age of 50, no matter what, even if we're like, we're too young to get the shingle shot.
Exactly. And it's a two-dose series. And the whole thing about this is that, when we had chickenpox or the chickenpox vaccine as a kid, as we get older, we lose that immunity. And getting that booster with the Shingrix vaccine, that helps prevent not only outbreaks, but mostly the complications of it. So it's very important to get that vaccine series.
Okay, that's got to be on my list then. All right, next on the list, how about pneumonia vaccine?
So pneumonia is a little bit tricky. There is more than one pneumonia vaccine, and it depends on the age group. If you are otherwise healthy, you don't have lung disease, you don't have diabetes or heart disease, usually the recommendation is to get that pneumonia vaccine at the age of 65 and older. However, there is a big part of our population that do suffer from diabetes and are like asthma or lung disease from maybe smoking and or like immune suppression. So anybody over the ages of 19 and up may be recommended to getting a pneumonia vaccine.
All right. And let's talk about this. RSV is something that we talk about all winter long. It seems we can't, talk a week without talking about RSV. Now that it's summertime, maybe our mind is not on that, but let's focus on RSV. What is it? Who needs to get it?
For sure. So I think, the when we hear about it in the winter, it's compounded on top of flu season, and it affects our most vulnerable like infants, right? And so the folks that, as well as older adults. So pregnant women who are towards the end of their, I want to say, I think it's like somewhere between 32 and 36 weeks in their pregnancy, they should get the RSV vaccine because that immunity passes on through like breastfeeding and such to their infants. And then adults who are essentially older than 75 years old should get the RSV vaccine. But again, if you have any other like heart disease, diabetes, or lung disease, that age recommendation is like 60 and up. And again, it just prevents having a viral pneumonia and that risk of getting hospitalized for the complications thereof.
Mm-hmm. All right. Are there other vaccines that a pregnant woman needs to make sure that she has?
I would say that, there is quite a bit of few, but I would, that once you're in care with your OB physician, they definitely check if you've had your childhood vaccines, if you've been immunized against measles, if you've already had hepatitis B or hepatitis A vaccines. But what's important, we know that pregnant women do have more serious complications with RSV, with flu. Also, they want to, for every pregnancy, a pregnant woman should get the Tdap vaccine, and that's the one that incorporates for whooping cough. You just want to protect your infant from getting that, and that's why like maternal vaccination also protects the infant.
Gotcha. Okay. And I think a lot of people think, well, if the vaccine's not going to just like totally make it so that I won't get it, I don't want it. But your point was the vaccine helps with lessening the severity.
Right. And that's the thing. It's so hard. I wish there were shots out there that were just like 100%, and like get me through this. I don't want to have any complications from it, or not some complications. I just don't want to ever get the disease that's supposed to prevent. But in large part, um, you know, there are very few vaccines that have such high efficacy, except for the measles, mumps, and rubella vaccine. Actually, kids who get 2 shots, you're like 97, 98% protected. But when you think of like pneumonia vaccine or even the flu vaccine, they often have to be reformulated to try to really get to like the most invasive strains. There's been all these different pneumonia vaccines, but the latest, right, the formulation of the PCV20, that one is it targets like this 20 most invasive forms of pneumonia, and it gets a pretty good effectiveness of 75% for invasive disease, which includes
that's so
like hospitalizations.
bizarre to me that you would say that there's 20 different invasive forms of pneumonia, and those are the most invasive. I didn't know that there were 20 different kinds of pneumonia.
Right. Well, the strains of it, right?
Right. Mm-hmm. All right. So what we're going to do is we're going to continue talking about vaccines. No matter what age group we're talking about, there's probably a vaccine in your age frame at this moment. We're going to continue talking about that coming up next.